friends, today we are discuss a topic ulcer, an all type ulcer, and what is the causes and sign and symptom and treatment. Today we are discuss everything. Friends, ulcer is a bacterial infection and fungal and viral infection. In mainly ulcer are two types, peptic ulcer and non-peptic ulcer. Peptic ulcer, in ulcer are production of pus and formation of pus. Friends, pus is our body include serum, the damage of blood, and that is the convert to the pus. First of all, the first stage of the ulcer, first step is the red dots. After on the skin, first a red dots. After that, our body are in histamine. Already I am discussed last video, friends. Histamine. Please check out the description. And our also muscles and skin have a histamine, including blood. In any type of viral, bacterial, and fungal infection inside of the body and on the body, our histamine are activated. After that, the some allergic reaction. First, a starting period of the some allergic reaction. After allergic reaction, a skin on the one spots, red spots. After that, the bacteria are grow and the production of more amount of bacteria inside the skin. Then develop of the ulcer. That ulcer are formation of the pus. That is a peptic ulcer. Any ulcer are formation of the pus, that is a peptic ulcer. And also that ulcer are also our include a stomach like abdominal ulcer, duodenum ulcer. That type of ulcer are peptic ulcer, friends. And mainly peptic ulcer are the bacteria are gram negative bacteria are heavy in our body. That is a peptic ulcer. And fungal infection ulcer are mainly for the damage of the our skin. Skin are damaged and not a formation of any type of pus, that is a fungal infection. And also upper respiratory tract infection in the viral infection. If our trachea and bronchitis, that type of disease are including also pneumonia, that type of ulcer, friends, because the group of bacterial, fungal and viral infection are infected our lungs and also a stomach and also liver and another part are damaged. After that, the create of the ulcer, that is a infection, that type of infection called ulcer. And what is the sign or symptom, friends? If persons are suffering to the suppose abdominal ulcer, the abdominal ulcer are sign and symptom of inside of the abdomen in more excess of the pain in right side and left side, anywhere the excess of the pain, and sometimes the pain are very excess, and after that sometimes pain are relief. If you are take painkiller, the pain are sometime relief, but after that ulcer bacteria are activated and pus more amount of the pus inside of the stomach, the ulcer are very dangerous and very painful. That type of ulcer are peptic ulcer, and bacteria is the gram negative bacteria, friends. And also our skin and mainly childhood, a small child like 5 years to 12 years child are suffering to the fungal and bacterial infection on the skin. And once time you look in any child's, maximum childs are suffering that type of ulcer. The red spot of the hand and also another body part of the first red spots and rashes, that type of ulcer are bacterial and fungal infection. Friends, how to treatment of the that type of ulcer? Normal ulcer, you give the prescribe your doctor. If you are practitioner and if you are medical student, then you are give the, if you first you diagnosis this type of ulcer. Suppose bacterial ulcer, you give the antibiotics, friends. And antibiotics, if our after upper respiratory system and our lungs, that type of damage, if damage are any body part like lungs and our respiratory tract and mouth, that type of ulcer are gram positive bacteria, friends. And our abdominal to lower limbs, that type of infection, any type of, that is a gram negative bacteria. And two type of bacteria, friends, and medicine are also two types, because gram positive bacteria are some compare for gram negative bacteria to low powerful, and gram negative bacteria are very high powerful. Then you judge and you diagnosis this type of infection. If gram positive bacteria are infected inside of body, then give the mainly for different type of antibiotic. Already I am the last video we are discussed meropenem, one antibiotics, friend. You check of our link. The meropenem is the very good antibiotic in abdominal ulcer, duodenum ulcer, and inside of the any type of ulcer they use that type of medicine. And also the races and on the skin any type of bacterial and fungal infection, that type of use some antibiotics and after antifungal drugs, friends. And after that, if you swelling and redness on the skin, you use for corticosteroid and anti-inflammatory drugs, friends. And I hope, friends, this video are useful, and this video are useful. Please like my video and subscribe my channel, friends. And thank you very much, friends.